Welcome to the Not Just a Pony Ride podcast, presented to you by Hetra University. If you've landed here, you're probably passionate about how horses help people. Whether you're an instructor, therapist, in the business, or have experienced equine assisted services yourself, we're glad you're here. Join us as we talk about the benefits, the science, to-dos, how-tos, and all of the reasons why what we do is so much more than just a pony ride. And now, from the Hetra campus in Gretna, Nebraska, here's your host, occupational therapist Katie King.
Hey, welcome back. Today I have Lisa Harris back on the show. We're excited to have her. She is a very well-accomplished woman of many expertise. She has an MS in physical therapy and veterinary science. She is a clinical specialist in hippotherapy and has served on the AHA board in all kinds of different roles. She is also a PATH International advanced riding instructor, and she currently owns and operates her own private practice that incorporates hippotherapy as a treatment strategy. So if you didn't hear from her the first time she was on, go back and check it out. Season 1, episode 19, I think. We talked about a ton of hot therapy topics like the American Hippotherapy Association, billing, insurance kinds of things, all sorts of stuff. So go back and listen to that if you haven't. But today, she is back on to discuss an important topic, therapy positioning on the horse. Now, this could be everything from riding forward, backward, supine, prone, hands and knees, or quadruped. We can put our clients in all kinds of positions as therapists to facilitate different outcomes, and it can all seem a little bit confusing, and we want to make sure that we do it right to protect our horses, our participants, and ourselves too, really. So don't worry, because Lisa is here to help us. Just a reminder, Lisa is a licensed professional that is trained to complete these maneuvers. So before you start doing any therapy positioning, always make sure that you train yourself, your horses, and prepare your students adequately so you have success. Enjoy. Hi, Lisa. Thanks for joining us today.
Absolutely. Thank you for having me.
Well, I'm excited to share you with our audience today. Do you want to tell us a little bit about who you are and what you do?
Sure. I am a physical therapist from Lexington, Kentucky, and I currently work in a rehab hospital, primarily in outpatient, and see outpatient orthopedics and neuro, all ages. So we have quite a variety of patients that we see. And then I also have a private practice incorporating hippotherapy. So that is a lot of fun. Just moved to a private practice, was hospital-based for a while. Was partnered with a PATH facility, and our hospital was partnered as well, and just moved to a private practice. So it's been quite an adventure.
Wonderful. So let's talk a little bit about something that looks funny that we do as therapists. And parents will sometimes watch and be like, why are you doing that? Why did you just turn my child around backwards on a horse? And I think that a strategy or a tool that we can use while we're mounted is using hippo positioning and hippo transitions, and what that means for our participants and our patients that are doing that with us. Do you want to explain what that means and kind of why we do it? And we can kind of talk about maybe some of the more common ones that we do.
Sure. It's interesting because, just a little background. So when the therapists, our founders, basically went to Germany to learn about this treatment strategy called hippotherapy, they learned having the client in a forward sitting position, kind of a classic position that we would think about somebody being on a horse. And so it's interesting that we come back to the States and we've not only included that, but now we've increased the challenge in some cases for some of our clients by adding different position changes and also by overlaying functional activities. So we have this amazing base level of equine movement that can impact us in so many different ways, even just sitting forward in one position. Yet we also have different positions that we can use if we want to change the challenge or increase the challenge, or maybe decrease the challenge of for example, of sitting. Maybe someone can't sit up. That's too challenging for them. And so we need to alter that position. So positioning also came about as a way to change what we do and to make it more safe. Because early on, we did something that we called back riding, or later tandem hippotherapy. And we don't encourage that anymore, but that's where the therapist would sit behind the child and help position them. And, it sounded great at first. Many therapists that were NDT trained thought, wow, I can really sit behind the client and I can really help facilitate what I want, and I can handle them the way I want. And their posture is going to be so much better, and they're going to be well supported. And it sounded great, but we had a couple things that changed our minds as we evolved. And we are definitely a constantly evolving organization. But safety wise, we had a few therapists that had accidents during that position. And one in particular was one of the best therapists around, one of our founding members, and an excellent horse person, an excellent rider in her own right, an excellent therapist with the best team and the best horse and all the equipment. So all the safety measures were set up, and yet they still had a fall. They still had an accident. Nobody was hurt. The therapist, I think, was hurt a little bit, and she was fine later, but the client was safe, no problems. But we thought, wow, if it can happen with that team, it can happen with anybody. And so that made us really look at it. And then the second thing was, around the time that I was becoming involved with the American Hippotherapy Association in 97, I was working with a really great gentleman by the name of James Rooney, who was a veterinarian, and he was doing studies at the University of Kentucky at the Gluck Equine Research Center. And he was studying loading the horse's back in a variety of positions, like right over the center of the back, and then further on back toward the loin of the horse. And he was showing that the horse is not well supported as you get further back on the horse's back, as the load gets further towards the loin. The horse is not as well supported with their own muscles, and they are more likely to be injured. So we're putting our clients potentially at risk, our therapists potentially at risk, and our horses definitely at risk by doing that back riding or tandem hippotherapy. So we're like, we've got to figure something else out. So that's where positioning came in also for those kids that cannot sit up. And we thought, wow, in the clinic, we put them on their bellies, we put them on their backs, we put them on their sides, we put them in different positions. Well, why not on a horse? So maybe we need some props to help us out, some wedges or bolsters or whatnot while they're on the horse, some boppy pillows to help them out, to help support them. Also, that frees up our hands a little bit. So maybe positions increase our challenge. Maybe they help us accommodate the children that cannot have that forward sitting position. But one thing I want to note also is that it can be very inappropriate for larger children or adults. So we have to consider the stress to the horse, our handling technique that we're going to use, how we get that child off in the case of emergency. So all those things we need to consider. So positioning is not for everyone, right?
Right.
And then when we're thinking about positioning, we need to have other things to consider as well. What is our purpose? What is our goal? And that's what we do every minute that we're in a therapy session, right? So we need to have a purpose behind putting the child in a certain position. Are there precautions or contraindications to putting this child in that position? Is the horse trained with children in different positions? I had worked with a horse one time that when you change the child's position early on, when we were doing some work with mock sessions, and we would have some children that were not clients, and we would be working with them on the horse would try to kind of turn the hind end around or try to move with the child to stay underneath the child, being honest. But that horse has to have training to be able to accommodate to the different positions of the children. And then we need to make sure that we have protection for the horse and the client or patient to make sure that they're best supported in that position. And certainly we can practice these positions on a large barrel or vaulting barrel or peanut ball or something that we have in the clinic. so that the child gets used to them, but also you get used to handling. So therapists that are new to this environment, having a child positioning in a clinic, well, you're probably used to that. But then when you incorporate being on a horse, standing still, that's different.
Mm-hmm.
And then when you incorporate that being on a horse that's moving, that's even more different. So we need to get the therapist's hands used to that as well. We need to keep all those things in mind in terms of positions.
It's a whole nother ballgame once you start walking, And I think the other thing that makes a big difference too is the height factor. And you don't think about that a whole lot. You can position on the mat, ergonomically from, definitely a therapist standpoint, ergonomically, that makes more sense when you're on the mat or on the floor, wherever you are. And then you start to work on a horse that's a little taller, and then you got to kind of figure that all out too.
Right. And, that may determine your horse choice.
Mm-hmm.
It's definitely going to determine your selection of equipment, but you're going to need to think about which horse that you're working with, because we don't want to hurt our bodies. That's not going to help our clients if we're not able to continue to practice over a long period of time. And there's a lot of, we've looked at quite a bit at body mechanics. In fact, that was a presentation I did with Kathy Splinter-Watkins at a conference, 2 conferences ago, was on body mechanics. And Rebecca Cook has done a lot of work looking at body mechanics as well, with people that incorporate hippotherapy as a treatment strategy. So it is important that, we're not reaching up onto a high horse with our shoulders above 90 degrees of abduction. We're not going to last that
Mm-hmm.
long. So we need to make sure and use a horse that's appropriate, that we can make sure that we can position the client safely and also use our correct body mechanics.
Yeah.
This episode of the Not Just a Pony Ride podcast is sponsored in part by
Equiforce. Equiforce is a database that allows you to track every facet of your organization, from horse, donor, and volunteer management to scheduling, grant tracking, incident reports, and tracking participant progress too. This is not a one-size-fits-all setup. Instead, Equiforce personally works with you to learn how your facility functions and takes note of your specific terminology so that they can create a unique system to match the needs of your organization. And of course, Equiforce provides an ongoing training and support so that your database can grow with you. Visit them at www.equiforce.com. That's EQUI-FORCE.com. So what are 2 of your favorite positions to put clients in? That's probably a loaded question.
Right. Favorites. I don't know that I have favorites. It's going to be what's appropriate to the client, of course.
Right.
Certainly many of them are useful. So I'll go over a few of them. You can have someone backward sitting instead of forward sitting. That's certainly going to change the visual information that has been given to them. That's going to challenge them more vestibularly, right? Because we're going to change the visual system. They're going to need to have more hip range of motion to be able to get into a backward seated position. The horse is always wider in the back than in the front. So we need to remember that. It can provide a nice surface for weight bearing, being in a backward seated position. And some people use it to help position the pelvis a little bit more in a neutral to anterior position. And I would just always caution you to make sure not to automatically turn someone around and change position for that purpose, to get that anterior pelvic tilt, but really to utilize the horse's movement to make sure you have the appropriate movement first in forward sitting, and make sure your equipment is good and the child's positioning is good of the legs and whatnot, because all those factors can impact that ever so popular sacral sitting that a lot of our clients like to do. So my little caution there. But so backward sitting, we can put them in side sitting. Of course, you're going to get more lateral weight shift there, facilitate the lateral trunk a little bit more. So that's a great one. Modified side sitting, where you're going to get a little bit of trunk dissociation, trunk rotation. So that's a good one.
On modified side sit, the less lateral, but not quite forward, right?
Yeah,
Mhm.
right. One leg is over the front of the horse, the horse's withers,
Yeah.
and bent, and the other leg is underneath, as would be typical for forward sitting. So it's kind of like halfway from forward sitting to side sitting.
I like that for my, like you said, trunk dissociation, which for the public separating that those hips and shoulders and being able to move them more independently of each other. And my friends who don't like to cross midline or do things like that, sometimes that's really hard, is to get
Right.
their top half of their body doing something different and the bottom half, even the left and the right sides, but top and bottom too, doing and feeling something different.
Absolutely.
Mm-hmm.
Absolutely.
Yeah.
Right. So, and then we have prone and supine that we can do. And you can do prone over the barrel of the horse. So, the client is facing sideways, basically over the barrel. That can, if they are entirely flat, they're not propped, they're just prone, lying over the barrel, then that can certainly help relax spastic muscles. It can be a good position to help with flexion of the body. So very relaxing, very calming. Interestingly enough, one of the folks that we learned from in Germany, Ingrid Strauss, she used to put most of her clients, if not all of them, in that position to start off with for that purpose, to help relax them. That was kind of a starting thing for her. So
Interesting.
that was kind of interesting. It can increase tactile input and proprioceptive input, of course, with a wide contact area that you have. Strong vestibular input that you're going to get for sure, being in that position. It can help elongate the hamstrings, one of the few positions that help elongate the hamstrings, which many of our clients are tight there. Many of us are tight there also. I mean, I think being a rider myself, I probably had the tightest hamstrings in physical therapy school. So I was always the one to go to for that. So this is one position that we can help elongate the hamstrings in. And then it can facilitate prone propping as well, because ultimately that child is going to want to sit up in it, or not sit up, but come up and explore a little bit. So you're going to get some good axial extension of the head, trunk, and the hips as well. So in terms of speech, you can actually facilitate tongue protrusion that way. So that's kind of a cool thing. And it may allow the opportunity for expressive language also to move out of the position. But we need to consider that the hip should be over the spine of the horse, and we need to make sure that blood pressure is not an issue, because it is more vestibular intense situation. Certainly that could lead to some postural insecurity. We want to make sure breathing is okay, not impeded in any way. And of course, we need to train our support staff to help us.
Yeah, I always worry about that in prone, when everyone has been in that position where like something's pushing on your belly and you feel like you can't breathe, kind of, like it's kind of a head rushy thing. Right. So I think getting that good positioning where the hips are in the correct position, and that makes it more comfortable for not only your participant, but also for the horse, I'm sure, with weight distribution and the way that all works.
That's right. You can do prone on the rump too, so many of the same considerations, but just a different surface, a little bit larger weight-bearing surface if you do prone on the rump. Supine. So this is a great position to facilitate extension, opening up the pecs, chest, if you want to do some opening up the arms, some arm exercises as well. The head should be in midline on the highest part of the horse's rump. So it's great when it works out that the conformation of the horse helps support the client, but that's not always the case. So sometimes we have to add like a boppy pillow or a little neck support there. You have to be careful with helmets in this position and in the prone positions, both. You may find that you need to use an alternative helmet in these positions, a softer helmet, so that the client's head is not put in an awkward position, or the chin strap is not choking them in any way. The trunk and pelvis of the client, we want to make sure position it so it aligns with the contour of the horse's back, and the arms are at the sides. We can work on extension of the arms, abduction, external rotation. The legs, we want to make sure we have some support underneath them as well, maybe a noodle or a towel roll. but a little bolster, something that can help flex the knees and thighs. Otherwise, you're going to end up with too much lordosis, too much lumbar lordosis.
Where's the best place for feet and lower extremities when you're in supine, especially if you have like maybe a longer torsoed friend or something like that that's mounted?
Right. So again, if you have such a long torso that the head of the client is going to go way beyond the horse's rump, it's too long. That's not an appropriate position. So we want to make sure that the head is well supported, not hanging over the rump. Even if you have a bumpy pillow, it wouldn't be safe. But the legs, you want, again, the knees bent. They're going to be forward of what would be typical forward sitting position. So they're going to be more closer to the withers, but not on the withers. They're still going to be on either side of the horse. And again, you're going to have a bolster, a towel roll, a noodle, something that's going to help support those knees. And then you can have support of your assistant and yourself as a therapist at the knee, and potentially it could be at the foot as well, but that might take them into more extension. So typically we just have it at the knee right there, but they're well supported with their legs in front. Think about a supine hook line position that you would be doing on a mat. It's very kind of similar to that position. Some people even do that position with the feet on the horse, and they can ask the child to bridge. But in general, with a supine position, the feet would be free and you would be having those legs supported as if you were on a mat, supine, with the knees, with a bolster underneath the knees.
Okay.
So this can be a great position for facilitating midline. You're just going to want to make sure and monitor, again, head position, body position, blood pressure. And again, it's increased vestibular input. Not everyone likes this. It can be a pretty intimidating position, but it can also be a great position, as can prone, for manual work, for rib mobilizations and manual therapy around the trunk.
Yeah. So many wonderful things that we can do. The horse's movement is one thing, right? And then you start to add layers of all kinds of other things that we can do.
Absolutely. And the most important thing is to keep it simple. If you're learning about use of the horse's movement, I'm constantly amazed on a daily basis about the benefits of using the horse's movement and the power of using the horse's movement in its own simplicity and not overlaying too much.
Well, thank you for sharing. I just can't thank you enough for sharing your wisdom and knowledge today. I learned a lot. I think our audience will too. So thank you so much.
Great. Glad to be here. Thanks for having me.
Thanks for listening to another episode. Until the next one launches, stay connected to our community by joining the Not Just a Pony Ride Facebook group. There, we share exclusive educational content, answer your questions, and review new and exciting developments for the EAS community. Don't forget, if you have suggestions for future episode topics or a lead on a great guest that you think our audience would enjoy, click on the link in the show notes or visit us at hetrauniversity.org. This podcast is presented by Hetra University, an educational arm of the Heartland Equine Therapeutic Riding Academy. Hetra University's mission is to provide high-quality educational offerings to our participants and the EAS community. If you'd like to help us work toward our mission, you can make a donation by visiting us online at hetra.org. Again, I can't thank you all enough for helping Hetra change lives one stride at a time.